You're listening to Rise Above, a Rogers Behavioral Health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction. Hello, listener. Welcome back to another episode of Rise Above, a podcast from Rogers Behavioral Health. Today, we are joined by a familiar voice here on the podcast, Aaron. He was on the podcast a few months ago, and he bravely shared his journey through substance use treatment and how through all of the setbacks that he faced, he stuck with it and has now been sober for a few years. Well, Aaron is back today to talk about some new health challenges he's having physically and how they've impacted his mental health as well. And alongside him, we have Dr. Jerry Halverson, Chief Medical Officer here at Rogers Behavioral Health. He's here to help us understand the connection between physical health struggles and mental health challenges that come along with that. So, Dr. Halverson and Aaron, thank you both so much for being here today.
Thank you.
Good morning.
So, Aaron, you have an update since the last time we spoke. How are things going?
Yeah, since the last time we spoke, a couple of things have progressed, kind of starting with around Christmas time last year. I had COVID, and then in January got the norovirus, and then, kind of recovered from both of those. But then I began having some pretty significant kind of symptoms of liver cirrhosis, and it's something I've known that I've had since 2018, but I've had a handful of doctors say that a transplant didn't seem likely in my future. So when I ended up going to the hospital actually 4 different times in the span of about 6 months, I've had 3 blood transfusions since then. And it was highly recommended from a local hospital that I go to the Mayo Clinic and have an evaluation done. So I did that, and it was pretty all-encompassing, a 4-day stay down there with 23 appointments. They do a great job, of certainly testing you from head to toe. And the ultimate outcome was that I was very healthy, minus the liver part, which I do need a new liver.
So Dr. Halverson, from your perspective, what are some common mental health challenges that someone faces under these conditions?
Yeah, obviously this is a lot of stress, even just dealing with the health issues, and the health issues can have direct effects biochemically on the mood and psychiatric disorders too. So it's one of the things I think is important for people to understand is that there are common risk factors with mental illness, substance use disorders, as well as medical illness, which is obviously particularly severe medical illness, such as liver failure. The most common ways that these manifest as far as behavioral health disorders are oftentimes anxiety disorders like panic disorder, generalized anxiety disorder, PTSD, but also mood disorders like depression and bipolar disorder. Particularly folks that have liver failure, over 2/3 of them have what we call a comorbid, also have a depressive or anxiety disorder. So it's very common. So when you have people going through the health issues like Aaron is going through, it's something that as a psychiatrist I'm very well aware of, and I am attempting to support and look for whether there's a comorbid depression or anxiety. As I said, just the stress of going through all of this is anxiety provoking, but also there are other issues that can cause if your liver is not working well, you have pain, you're not processing medicines, you're just not feeling as well as you normally feel. So you're more likely to have a subsequent and secondary depression or anxiety. And we also know that if people have depression or anxiety, as well as a significant health challenge like this, they don't do as well. So it's important as a psychiatrist to be kind of aware that depression and anxiety can come with illnesses like this. Sometimes maybe the medications that you're taking can cause them. Sometimes it's the situation. Sometimes it's just the stress of the challenge that can cause this. And as a psychiatrist, I really want to stay on top of it, making sure that there's a therapist involved, making sure there's someone that can talk to you about the stresses and kind of how to manage this, making sure there's a psychiatrist involved in case medications are needed. When your liver's not working 100%, some of our medications can be more difficult to use. So it's important to have someone keeping an eye on that, because the liver plays an important role in processing a lot of the medications that we use. So sometimes if your liver isn't working at 100%, some parts of it are working too much, some are working too slow. So you have to be aware that there are chances that the medications that you're on are either getting processed too quickly or not quickly enough, and they hang around, so they kind of build up over time. So it's really, really important to understand that. And as I said, as psychiatrists, we're medical doctors first, so we have a lot of awareness of how the behavioral health can interact with the medical health.
And Aaron, I saw you nodding your head at quite a bit of that. So how is your mental and emotional well-being? I mean, how has this affected you?
I mean, it's living in kind of a state of worry. I'll just put it that way. I did kind of make the decision early on. I'm blessed to have a great support system around me, which has been key. But I embraced it early on, and my spirit animal is the buffalo, and the buffalo runs right at the storm. So that's kind of how I approach this. Just knowing that it's reality, and the end all be all is, my children. I have 3 kids, 14, 13, and 11, whose mother passed away, so she's no longer here. So preserving my mental health and physical health is really, really important.
Are you using any coping strategies, that you wanted to talk about?
Yeah, I do regularly. I do regularly see a counselor as well as a psychiatrist, and they work in conjunction with the Mayo Clinic, because there's a psychiatrist at the Mayo Clinic then as well, who kind of calls the shots, so to speak. And then locally, it's supported here. And I've traveled a lot. On the days where I do feel really good, I take advantage of them. Not necessarily because of a state of worry, just well, maybe a little bit state of worry, but that I think it's better for my mental health to be as positive as I can be, because I do the depression part, particularly in the winter time, has been a part of my past. So being bipolar, I have that to manage as well. But yeah, there are days where it's extremely difficult, where that you have a low, and you get mad at yourself for not quitting drinking, sooner, or things from the past that I can't change. And then there's other days where I'm ready to go in and get it done, and go on with life. So yeah, it's kind of it's a roller coaster. It's all over the place. And so it's my job to kind of steady the ship, so to speak. And again, the support system around me has been, because I've been pretty open about it, has been pretty substantial. And that to me has been a big part, because I know I don't have to carry this alone. So there's other people that help me through it, that they don't understand what it's like to be in these shoes, but they do understand what it's like to support a friend, or support their son, or support their dad. So yeah.
Dr. Halverson, thoughts on, how important is a support system in this case?
Yeah, I mean, I think a lot of what Aaron says is really something that people should listen to. It's very important, and obviously this is a significant health concern. There are other health concerns: cancer, chronic pain, heart disease, HIV infection. We do know that if you have depression or anxiety and you kind of let it go, or you hope over time it'll get better, oftentimes it won't get better, and it really does, we know, make the outcomes worse. When you talk about staying positive and continuing to keep moving forward and not looking back, because you're right, there's nothing you can do about what's happened in the past. All that you can control is what you're doing now, how you're feeling now, and moving forward. And frankly, the positivity will help keep your support system. It'll help keep your support system engaged. Obviously, there are always times that are difficult, and people will say, "Well, boy, if I have that big medical challenge, I'd be depressed too." And again, I think that kind of downplays the impact that depression can have, and it isn't a sentence that, boy, since I have this medical problem, I am going to be depressed. It really does depend on how you look at it. And I think, your ability to keep a support system and seek out your support system, being open, I think all of that is going to help you stay engaged. It's important to do what you can. And you're saying, when I'm feeling well, I'm traveling, I'm doing other things that I enjoy. Behavioral activation is kind of what we say, in order, a lot of people that are depressed, whether they have a significant medical challenge or not, when they're depressed, they stay at home, they don't do the fun things that they want to do. And, believe it or not, that tends to keep you depressed. It tends to keep you feeling low. So what you're doing with the behavioral activation, and obviously there are days where physically it's going to be more challenging than others, and you have to have some ability to kind of understand those days and give yourself some days where you give yourself a break. But know that for the most part, if you continue to be positive, continue to move forward, those are going to really help your days be better. The more that you perseverate on the past and things that you can't change, rather than keeping yourself active, distracting yourself, moving forward, the more that you stay in the former, the more likely the depression is gonna be an issue. It's gonna stay an issue, and it's going to affect your outcomes. So I think it's important to again understand that these things can happen. They don't always happen. The types of things that you're doing to move yourself forward, to the protective factors, the keeping supports, getting out of the house, moving forward, advocating for yourself. Those are all important pieces that you can do that can not only keep the depression, anxiety more at bay, but also can help you do better at the end of the day.
Yeah, the depression is one thing I admit I'm a little worried about kind of going into the winter months here. So looking at various
Does get cold up here, and
Yeah.
there it isn't as sunny, that's for sure.
Yeah, I'm not a fan of the cold weather. So that's why when I travel, I typically go somewhere really where the sun shines a lot and it's warmer. But
Have you tried a light box, bright light therapy? Actually, particularly
yeah,
for folks that have a seasonal component, it can be very helpful. And obviously, you don't want to stare at it. You just kind of have this box on in your environment, and it does get you more light, and light does increase your dopamine, and that does help you feel better. So if you haven't looked into BLT or bright light therapy, that can be helpful.
yeah. In fact, it's something you have at home, I believe. Yeah,
Yeah,
my parents did get me one about 3 weeks ago. So yeah, that's kind
I
of
think
the
that can be helpful.
part of the being proactive.
Yeah.
But yeah, the anxiety part is again kind of more centered around worry. It's kind of when you get into the what ifs, those can be not productive. But I've leaned a lot into The support system, I say, but actually just friendship. I've really invested more time into that. I've spent more time with my kids, especially my son, Jackson, who's on the autism spectrum. He's just a joy and just fills me. And my other two kids are involved in so many activities that it's nice to kind of have that normal life, so to speak. And they understand when dad has a rough day, dad has a rough day. And they understand why, but they understand too, it doesn't last forever. So, and that I'm doing something about it.
And we will be right back. Real quick, I wanted to take a moment to talk to you about WISE, the Initiative for Stigma Elimination. It unites people across the nation to support those touched by mental illness and addiction. The compassionate approach champions personal stories and powerful connections, fostering healing by reducing stigma through evidence-based practices. Rogers Behavioral Health supports the work of WISE through their Community Learning and Engagement Department. WISE collaborates with a diverse network of organizations and individuals united in the fight against stigma. You can learn more about WISE, explore their 4 key programs, and connect with them by visiting the website www.eliminatestigma.org. And now back to the interview. I was going to ask you, Aaron, about stigma. I know, we've talked about stigma when it came to the substance use the last time we spoke. Has stigma reoccurred with the health challenges as well?
Yeah, we've had a little bit of that. Yeah. Part of, me being me is can be a very public person, say on social media. And so when people know that about me and then they see me sometimes in, traveling and stuff like that, and they say, well, he doesn't look that sick. And there's that, kind of judgment without knowing the whole story, when in fact, I'm actually helping my health by doing those things.
Dr. Halverson, what can healthcare providers and communities do to reduce that stigma?
Well, I do think over time there have been issues with stigma, particularly vis-a-vis liver transplantation, with folks that have had substance concerns in the past. There's I think, an extra hard look to make sure that folks are maintaining their sobriety, have a program. And I think some of that is reasonable because obviously if you haven't worked hard to work on the addiction, there would be concern that, a new liver, you'd have the same problems unless unless you're able to address those problems. I do think though there's some stigma there too. I think that process is pretty onerous, as providers, as a psychiatrist, we advocate with insurance companies, with our colleagues at the, in the different programs. This is when you talk about, getting on that list, where you're at on that list. I do believe that there are some stigma issues that are associated with that. I don't think it's the top thing that they look at. But it is something that we can continue to work to help, and obviously being available to help with managing comorbid mood or anxiety disorders is important afterwards, because that's, again, once they place the liver, they want to do everything possible to make sure that it goes well. And again, as treating providers, we can do what we can do to try to keep the mood in a good spot, which makes it more likely that everything will stick and work well.
And I think probably the main reason that I haven't experienced that stigma, and I know other people do, I haven't experienced it as much because I'm so open about my recovery and what my path has been, how I got here. And the fact that I run a startup that helps people, stop using drugs and alcohol and helps with mental health, that I've worked in treatment centers and, again, done the same thing there. And so it's not just a part of my life that I do, 1 hour a week. It's pretty much kind of all day, every day. In fact, it's, late last night, we got a message on Facebook from someone in Little Rock, Arkansas, who said, help me. And we ended up going back and forth. I looked up a treatment center and, told her where to go and, what to tell them, and gave her words of encouragement. So when you have that a part of your life, that's what I would tell people is, try to be as open as you can about your recovery, because the more people know, I think the less they judge. It's what they don't know that sometimes they judge on you.
They kind of fill in their own blanks then.
Yeah. I think, my past is my past. I can't change it. But, the almost 4 years of sobriety I've had has completely 100% changed my life. And so, if anything, I kind of look at the whole path was, leading to this, but leading to this in a time of my recovery that I can handle it.
Well, I think it's important for people to again to hear your story, because then they could hopefully make different choices earlier on when there is something that they could do about it. So I really appreciate your openness. I mean, I think it is helping you move forward the way that you're describing it, but obviously there's effects that others hear your story and hopefully make different choices. Although again, addiction is a disease. It's not all about choices. But you can certainly make choices to put yourself in positions that are more difficult or less difficult to be able to maintain your sobriety. But again, I think people hearing about it, hearing about successful sobriety and being able to move forward, give people hope, because I think there are a lot of folks. I don't want to speak for the person in Arkansas, but there are a lot of folks that it feels like I've tried to stop and I haven't been able to stop. But I think continuing to hear about people that are successful and able to do it really gives people hope.
Yeah, I agree. It's been a big asset of mine. Of course, when I sat down with the Mayo Clinic as well, and answered all the mental health questions and pretty detailed questions about my recovery and what I do. Really on a daily basis, even sometimes down to the hour, like how many hours are spent on what topics and things like that. And I was really, I've been to treatment 11 times, but I was a student of it that whole time. I wasn't a victim. And so I took a lot of notes, which I still have. But that's really helped me. And of course, my training as a certified peer recovery specialist here in Minnesota.
And we will be right back. Everyone deserves a chance for recovery. That's what drives Rogers Behavioral Health Foundation. They're helping people get the mental health care they need, from covering treatment costs for those in need, to building clinics where care is hard to find, to funding cutting-edge research. They're making real change happen. And guess what? You can help. Head to rogersbhfoundation.org and be part of creating a future where mental health and wellness thrive. And now back to the interview. So Aaron, what's next for you when it comes to, your health and your personal growth? What's next for you and your journey, or how do you see it going?
Well, first and foremost, what was recommended to me highly was a living donor. I'm, O negative, and so anyone with O can donate. And so we've, began kind of that reach out process, and that in and of itself is kind of difficult. I found myself when I got home, after being at the Mayo Clinic, it was like, okay, we know what to do, but this is one of the few times that I don't know how to do it. And so I began reaching out to a lot of people that have either gone through a similar situation, and honestly, just good people who are strangers that are willing to share that information and the various ways that people have gone about, getting a donor. And that's one of those things too, where you got to be very open about it. And so, there's kind of nobody in my life that doesn't know that I'm going through this and kind of has an eye out for me. But that was definitely, and it still is, a very stressful reality, because there's always the possibility that this doesn't end the way I want. That being said, my parents my parents kind of hit me with a lot of reality that, considering some of the path that I've gone through, it was all just kind of hopefully preparation for this, and there's something bigger for this after me. This isn't where my story ends. And so keeping that attitude, and people appreciate that, I think, too, when you're sharing your story, that you are positive about it. Because again, I wholeheartedly agree that it does have health, physical health impacts, having that attitude. And it's not always easy. I know sometimes I talk and make it sound easy, but it's not always easy. My fiance certainly knows that. She is very, very supportive, and she is going to be my caregiver. And she's definitely helped with the 4 days when I was at Mayo Clinic working on a paper for her college that was humor and healing. And so we made a series of videos and interviews and stuff like that, and centered around, the reality of it, and very informative, but also there's different ways to cope with things. And that's one that we've chosen to take, is just to go right at this, and let the chips fall how they may.
Dr. Halverson, any advice for Aaron or for other people kind of starting this journey in this way?
Yeah, I mean, to me, it sounds like Aaron is really doing all the right things. Literally going to the best place in the world for this type of care certainly doesn't hurt. He's trying to do what he can to line up supports, trying to stay positive. I think I just would continue to say that self-compassion continues to be a huge piece in everybody's journey with mental illness, as well as the types of medical challenges that you're doing. It's staying active. I'd use the word behavioral activation, which really is continuing to do activities that are enjoyable, which is something that we forget to do just because life is busy, or I'm busy ruminating on things from the past that I can't change. All of those things continue to be helpful, and staying active and engaged as much as possible. And obviously there's going to be days where that's not going to be as possible. But ultimately, the goal here, from my perspective, would be, if there are other folks that are dealing with severe medical challenges, make sure that you're connected with someone that is going to be able to help identify whether there is a depression or an anxiety disorder. If there is one, oftentimes the person is the last person to notice it. Family members might notice it earlier. Listen to them, be open to talking to people, because if you have again, if you have a comorbidity, if you have a depression or bipolar disorder or anxiety, along with one of these significant medical challenges, if you don't get it treated, you're going to do more poorly. Obviously, if you're depressed, you're not going to engage in that behavioral activation. You're probably not going to reach out to your supports. You're not going to get the help that you need when you need it. So it's important to be able to identify that and to be open to the help. And again, I think staying positive, there's really never any substitute for staying positive. And obviously people can't stay positive all of the time, but making an effort to keep moving forward and to keep engaged is I think really important when dealing with severe medical challenges like this.
Yes, it's the days that are difficult that I still find it difficult to share with people. Because I don't want them to either see me in that state or understand that I seem to maybe not have my arms around it. Things like, I get cramps quite a bit. I wrote them down here. The GI issues, water retention, bleeding that doesn't stop. And to add on to it this year, in addition to everything I mentioned earlier, I also have a hernia that they can't operate on until I get a new liver, and I had my wisdom teeth pulled out. So it's been a year where, it was frustrating at first, and then after a while, it's just like, what else, but it's nice to kind of get repaired all in one year, I guess. Yeah, that's the physical stuff that's a lot for me. A lot of times leads to, if I miss something because of, the heavy symptom day or something like that, or a series of days, that I get really down.
And that's where it's important to be able to reach out to your supports, to your family and friends, and being open to that, even when it's not easy to do it. Because if you do isolate, there's less chance of that getting turned around, and maybe a good sleep will make a big difference. But then that's still a day of a day that's lost. And frankly, if you're not reaching out to your support system, sometimes your support systems start to feel, hey, maybe they don't want me there, they don't need me there, and that's ultimately going to lead not to where you want to go. So it does its work. It's all of its work, as as you experience all of its work. But I do think the payoff is there at the end, as you continue to move forward and you have family and friends there to pick you up when you need them, because you might not know when you need them.
Yeah, that's certainly true. I would say one of the things I've battled that I don't know how unique it is, but with sleep, you mentioned a good night's sleep. That's been recommended to me quite a bit, because I have a lot of trouble sleeping, just for the pure fact that if I'm not here in 5 years, I want to experience as much life as possible, and I don't want to sleep through it. And so, yeah, that's sometimes become an uphill battle for me.
Yeah, we haven't talked about your specific challenges, but it wouldn't be uncommon for folks with liver problems to have trouble sleeping because of the medications, because of GI upset, and all sorts of issues throughout the night. And that's, again, there are some things that can help with sleep. Obviously, you want to be able to get up in the middle of the night if you need to be able to get up in the middle of the night. But if a lot of times are kind of ruminating or difficult falling asleep, and regrets and kind of getting caught up in that, obviously you can continue to work with your therapist to work on ways for you to thought challenge those and get through those. But otherwise, there's medications that can help with sleep, and with various medical challenges, particularly liver issues, it's not easy to find the right medication, because yeah, you want to sleep when you want to sleep, but you don't want to be tired all day, and that is sometimes the fine line that can happen if you're taking a medication and your liver doesn't process it like it should. Then you're just kind of half asleep all day, which is kind of antithetical to what we've been talking about and what you've been trying to do.
Yeah, that is something I've experienced as I'm, working actively with my psychiatrist now. I think we're on the third one that we've tried, to see if it works. And I understand that's part of the process, but it certainly isn't a fun part of the process. So some of them have different effects, but trying to proactively do it before the snow flies has been, a goal of mine.
Yeah, no, and especially again living up here in the upper Midwest, the snow starts flying probably pretty soon, if it
Yeah,
hasn't already by you.
yeah, yeah. It's a nice day today, though.
Yeah, but again, but this is all part of it. Your particular medical challenges make the kind of the medication, um, medication questions, and I know it feels like experimentation and titration and trying different medications, but it's unfortunately we're not at a point where we can just take a look at your liver enzymes and understand that this is exactly the right medicine for you. Maybe in the future we're able to do that. Right now we're not, and it's not clear how it's affecting different parts of your how the disease is affecting different parts of your liver. So there's going to be some experimentation. So I hope you don't take that too personally, and I would just continue to work with your doc and make sure that ultimately and have hope that ultimately you'll find something that works, because that's usually that's 99.9% of the time.
Yeah, the best success I've had is when I've been on a medication that works well, and then the support system. I would tell people that as far as the stigma goes, we've all earned the seat we're sitting in, and but just like we struggled back then, if you're almost 4 years sober now, you've earned the seat you're sitting in. And you're just as needed on this earth as anyone else, and just as worthy of the same health care as everyone else.
And ultimately, I mean, that obviously addiction is a struggle every day too, on top of what you're doing, what you're doing with your medical challenges, and you just have to continue to take it one day at a time and continue to move forward in the best way that you can.
Yeah, exactly.
Well, Aaron and Dr. Halverson, thank you both so much for joining me for this conversation.
Welcome.
And I appreciate
Thank you,
your
Aaron.
time.
All right. Thank you very much.
Well, listener, thank you so much for joining us again for this episode of Rise Above. Aaron's story is a really great reminder that mental health is deeply connected to every part of our lives, and that facing physical health challenges often requires emotional strength and support. A big thank you to Dr. Halverson for sharing his expertise and insight. And if you found this episode helpful, be sure to like and subscribe to be notified of new episodes. And as always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening.